All right, let's dive right in. Today we are looking at something pretty wild, the intersection of artificial intelligence and professional ethics, right in the world of physiotherapy. We're going to see how this crazy advanced technology is basically forcing us to take a hard look at the very soul of what it means to be a healthcare professional.
I mean, that sounds like something out of a movie, doesn't it? The perfect patient. But just imagine for a second, a patient who is endlessly patient, who can present with any condition you can possibly think of, and who exists for one reason and one reason only, to help students learn. Well, that's not sci-fi anymore. It's happening right now in medical training. You know, one of the single biggest hurdles for any physiotherapy student is just getting enough hands-on experience with a wide variety of clinical conditions. There's this huge gap between what you learn in a textbook and the messiness of a real human being. And that's exactly where AI is stepping in. It's building a bridge with these incredibly realistic, simulated patients.
So how in the world does this even work? Well, it's a really smart four-step process. First up, they pick the right AI tools. Think ChatGPT for spitting out all the detailed text, and another AI for creating a realistic patient photo. Then comes the really critical part, designing the prompt. They feed the AI super specific inputs based on established physio textbooks. The AI then generates a complete patient history. And finally, and this is key, real human experts jump in to review and tweak it for clinical accuracy.
And this is what you get at the end of that process. Check this out. Here's a case for a 62-year-old man post-stroke. The AI doesn't just give you a headline, it generates everything. His specific clinical findings, like reduced motor strength and even expressive aphasia, all the way down to detailed physiotherapy goals. It's a full-blown case study that feels completely real, ready to go.
And the advantages here are just massive. First, you get high scalability. That means you can create a gigantic library of all sorts of different cases almost overnight. Then there's consistency, which means every single student is learning from the same high-quality, standardized material. And finally, it makes everything so much more accessible, giving everyone, everywhere, access to top-notch learning tools whenever they need them.
Okay, so the technology there's no other word for it. It's incredible. It's going to make better students and down the line, better clinicians. But this huge leap forward really forces us to stop and ask a much deeper question. As our tools get smarter and smarter, almost limitlessly capable, how do we make sure we stay anchored in the human principles that define this profession in the first place?
And that question brings us right to the bedrock of physiotherapy practice, the 3 pillars of ethics. And look, this isn't just about a bunch of rules. This is the moral compass. It guides every single decision a professional makes, whether they're using a fancy AI or just their own 2 hands.
These pillars, they cover the whole shebang. We're talking about clinical practice with direct hands-on patient care. We're talking about research, pushing the boundaries of what we know, and we're talking about academic teaching, shaping the next generation. For all 3, ethical conduct is the absolute non-negotiable foundation.
So let's jump into that first pillar, clinical practice, because this is where those high-minded principles slam right into the messy, complicated reality of everyday patient care.
Let's walk through a dilemma that is way too common. Picture a fantastic clinician. Let's call her Dr. Sharma. Her clinic starts pushing these really aggressive revenue targets. Suddenly, she's feeling this pressure to maybe recommend a few more sessions than are truly necessary. And there it is, the classic conflict between the financial health of the business and the actual health of her patient.
So what did she do? She didn't cave. She anchored herself in her ethics. She made sure every single treatment plan was based strictly on the patient's functional goals and real objective progress. She documented the medical necessity for every last session, creating a paper trail that was basically bulletproof. And she didn't stop there. She actually advocated inside her own organization for better, more ethical billing practices.
And here's the bottom line. Dr. Sharma knew, deep down, that her professional integrity and reputation, something you build over an entire career of trust, is just infinitely more valuable than hitting some short-term financial target. That's a lesson for absolutely everyone.
Okay, now for a different kind of challenge, something a little more subtle. Let's imagine a physiotherapist. We'll call him Mr. Carter. He's treating a patient, but her son insists on doing all the talking for her, which is a common sign of respect in their culture. So now Mr. Carter has to walk this tightrope. How does he respect their family dynamic while still upholding his primary duty to the patient's own autonomy? His approach was just brilliant. He didn't shut the son down. Instead, he made a real effort to engage the patient herself, using simple language and demonstrations. He set up family meetings to explain that physical therapy is a collaboration, a team effort. He worked to empower the patient to speak for herself, proving that you absolutely can have cultural sensitivity and patient autonomy at the same time. They're not mutually exclusive.
And don't make any mistake about it. The stakes here are incredibly high. The data is crystal clear. A staggering 75% of patients who feel like they've been treated unethically, whether they were overcharged or just not listened to, they never come back. Once that trust is broken, it is almost impossible to fix.
And it goes way beyond just losing patients. We're talking about a 60% risk of having your license suspended by professional boards for serious ethical violations, especially when it comes to professional boundaries. This isn't just about a moral slip-up. We're talking about a career-ending mistake. All right, so let's shift gears now to the other two pillars, because ethical integrity is just as crucial when you're in a lab creating new knowledge or in a classroom shaping the future of the profession.
Now, while the core principles are the same, the specific challenges definitely look a little different. In research, it's all about protecting your participants, making sure the science is solid, and that your data is squeaky clean. Over in academia, the focus is on things like fair grading, preventing plagiarism, and maintaining proper boundaries with the students you're mentoring.
These little examples show what integrity looks like in the real world. You have a researcher, Dr. Lee, who was under immense pressure to fudge his data to get a publication. Instead, he had the courage to publish his null results, which is just as valuable to science. Then you have Professor Chen, who at first denied a student the credit she deserved, but it corrected his mistake and made sure she got the co-authorship she had rightfully earned. So here we are. We have this mind-blowing AI technology on one hand, and these timeless, unshakable ethical foundations on the other. How do we bring it all together? Well, it really comes down to a synthesis of three things: character, courage, and care.
This all leads to what we can call the unified ethical mandate. And listen, ethics is not some dusty old rulebook you look at once a year. It's a proactive, constant, reflective process. It is a deep commitment that ensures, no matter what new tech comes along or what pressures you face, our number one duty is and always will be to the well-being and integrity of the people we serve. And honestly, this is the absolute heart of the matter. Your skills, whether you perfected them on AI patients or in a traditional clinic, people will judge those by your results. That's fair. But your character, the person you are as a professional, that will be defined by your ethics.
So, as we stand here, right at this intersection of incredible innovation and fundamental principles, the final question really isn't about the technology at all. It's about us. It's a question for every single student, every clinician, every researcher, and every teacher out there. How will you define your character?